We know that in Alzheimer's patients with age, there's an increase in neuroinflammation. And so what I'm studying is one of these pro-inflammatory cytokines, just called IL-1β. And we think IL-1β is a really key driver of neuroinflammation and ultimately neurodegeneration in Alzheimer's disease. So IL-1β is a really potent inflammatory cytokine, and we know that it's increased in Alzheimer's disease. And we know it's so potent that it's very tightly regulated by the cell, and you need this complex called the inflammasome to trigger its activation. And so what we've shown in our lab is that inflammasome activation is really bad for the progression of Alzheimer's disease. So there's a lot of things that come out of the cell once the inflammasome is activated. So you have these things called AAIC specks, we have IL-1β, we have other inflammatory mediators. And these things just make a dog's dinner of the whole mess. In Alzheimer's, we already have this buildup of amyloid plaques. When you add these factors in on top, the cells that are in the brain just can't handle it. They don't know what to do. It's too many signals. And over the time of the patient with Alzheimer's disease, it's just this chronic activation that you see when you get these signals constantly, and the brain can't do anything about it. So this is what we're looking at in the lab where I'm working. So we know that amyloid-β actually can trigger the inflammasome, and when it's activated, it releases these particles that then in turn can affect amyloid-β deposition, so they actually make more plaques that in turn can affect the cells again. So it's this really negative vicious cycle, and that's what we're studying in the lab. So we're looking at inhibition of the inflammasome. So we use cells that are genetically depleted for the inflammasome, and we use pharmacological inhibition of the inflammasome as well, so that in our models to see if this is efficient at preventing amyloid deposition and the plaques that we see in the Alzheimer's brain. So that ultimately perhaps this could be a novel therapy in Alzheimer's disease. If we can show that we can target this effectively and well and safely in our models, in our cell culture models, in our in vivo models, perhaps down the road it could be something that's really important for patients.